Yeah, there we go. Okay, cool. Awesome. All right. Well, thank you so much for the invitation to speak here today. I always love speaking to you guys, just because even though it's an early morning, it's always a great opportunity to kind of connect across the pond. So today I'm going to be talking a little bit more about rodents. So thanks to Richard for kind of teeing up that that up for me. Um, but I'm going to kind of talk about it from more of a higher level perspective, and today is going to be kind of about the why. Why do we care about managing rodents? Considering that rodents are kind of one of the universal pests, we find them on every single continent and they can cause problems in almost every single continent. This is really kind of thinking about the why. Why are we doing the job that we do as pest management professionals? So let's first talk about public health. So public health is really the science and art coming together of preventing communicable diseases and promoting health through a community. And there are a lot of different factors that lead into this, not only assessment, but policy development, and then also kind of quality assurance of it all working together. But this is really kind of the main deal in order to try and realize how to prevent these kind of diseases in our communities. And we as pest management professionals kind of fall under all of this, really. We're part of that assessment piece, we're part of that quality assurance piece, we're a part of that policy development piece. And especially with all of the pests that we are charged with managing, a lot of these pests have public health implications. And so kind of thinking about this from the grand scheme of things, we'll first talk about the ways to a disease, right? So how do we, as we say, get down with the sickness, right? Now, I was going to put in the sound effect here, but I wasn't sure that was going to go over well on Zoom. So, so just imagine it. I'm sure you all can hear it right now. But anyway, so talking about how we get sick with diseases. And it turns out that we get sick with diseases a number of different ways. And the caveat I want to give about this is that transmission is complicated. There's a lot of different factors that can play into someone getting X disease from a certain vector or even a certain disease uh, pathogen or something like that, excuse me. So just to give examples of how someone might get sick or the kinds of things that can influence how a person might get a disease, there's a whole bunch of things to consider. It's not only things like the type of pathogen, but how virulent that pathogen is. Also thinking about even the other side of it, thinking about the host competency or the host susceptibility. Does that host have maybe an immune system issue that causes it to become a problem down the line? And there's a whole bunch of other factors. This is not an extensive list, but this is what we need to think about when we're thinking about public health and the pests that we're trying to manage. So let's talk about some of the kind of two ways that we end up getting a certain disease. So number one is going to be that direct transmission. So anything kind of physical that is in the grand scheme of things in terms of getting that pathogen into the host. So again, that's going to be that things like physical contact. So for things that we're dealing with, sometimes that might be something as simple as a bite, especially with rodents, that can be a real easy pathway. But it's also something as easy as a droplet, especially after COVID and the pandemic that we all experienced in 2020. I think we're all very familiar with this potential as a means of getting sick. So it can be something as direct as that. But again, it's really focusing on that physical contact. So really coming into contact with the pathogen kind of face to face in that regard. But then there's also indirect transmission, and I like to kind of think of this as like the invisible punch. There's something that you don't quite know is coming around the corner. And another good way to kind of think about this, if we're going with our music theme here, is, there might have been a pathogen on that rose, and then seal kissed the rose, and now we have a sick seal, is kind of the way to think about that in that regard. Also, I forgot that the Batman Forever theme was the one that featured Val Kilmer. So just to kind of tie everything together in that, that little history there. But again, indirect transmission is contamination with a go-between. So that can either mean something like a vector, like a mosquito, or some of the other pests that we're going to be talking about later. But it can also mean something that, maybe a food product has been spoiled, or maybe there's something in the water. So basically that is kind of the vehicle for the transmission from the pathogen to the host. So what does this have to do with rodents? So we're going to kind of dive in a little bit more into why rodents are such important public health pests in all of the ways that they interact with us. So rodents, order Rodentia. So these guys are mammals that are characterized by their continuously growing incisors. And actually Rodentia has a wide range of different members of this group. So all the way from capybaras to hamsters, and then to the ones that we'll talk about next. And rodents are responsible for both direct transmission of disease and also indirect transmission. So before we get into all of this, we'll talk about the usual suspects here. So these are the ones that we generally think about in terms of public health pests, but it is no means a extensive list. So there are other rodents out there that are just as capable of causing disease, but these are the ones as structural pest management professionals we have a tendency to end up dealing with on the most. So let's start off first with a house mouse. So again, Mus musculus. This guy comes in around 127 millimeters to 206 millimeters long, about 14 to 28 grams, depending on how chunky they are. Their typical pelage is dusky gray, and their tails will be the same length as their bodies, generally semi-naked and dark in coloration. Moving right along into our rat department here. So we have the Norway rat. So this is Rattus norvegicus. Apparently you guys more call it the brown rats. We call it the Norway rat over here in the States. These guys generally measure in around 41 centimeters from nose to tail and can weigh between 200 to 500 grams, depending on, again, how chunky they are. They typically feature shaggy grayish brown pelage, but this may vary depending on what genetics they have. The length of the tail, though, will be shorter than the body, and then they also feature dark coloration above and pale coloration underneath, generally on that tail. And then moving into the roof rat. So I guess you guys don't really super deal with this that often, but unfortunately we do here in the States. So there's a couple of differences between their cousins. So again, Rattus rattus, also called black rats. These guys will generally be the same size as their cousins, but will feature longer tails and will be a little bit less in weight. So a little less on the chunky side, as we like to say. These guys are normally sleek and entirely black in color, but they can also feature brown with pale underbellies as well. Again, depending on the genetics. And these guys also feature more pointed snouts. Now, another thing to keep in mind about roof rats versus Norway rats or black rats versus brown rats is that these guys generally like to stick to the coastal areas. And then the Norway rats are kind of more everywhere, more cosmopolitan, as we say. So now we know the suspects. So let's talk about the different ways that these pests can transmit diseases. So first, of course, like we talked about, rodents are very capable of direct transmission. Anyone who's handled a cranky rodent can confirm this. So a lot of these will come through rat bites. So there's a couple of different diseases that can be transmitted this way. So rat bite fever, leptospirosis, and hantavirus can all be transmitted this way. And then the other thing to keep in mind too about this is that when a rodent bites anyone really, you're also exposing the body to other pathogens through an open wound. So this really is an open door or an open window, shall we say, that could allow other pathogens to go ahead and enter right into the body. So this is another public health consideration on that front. But rodents are just as easily capable of indirect transmission as well. I'm sure many of you are familiar with this aspect of it, especially if you're trying to find said rodent in the house or structure that you're dealing with. But they're very capable of surface contamination. This might be through feces or urine or even direct contact on food that's later consumed. And again, the good old set here: hantavirus, leptospirosis, salmonellosis, rat bite fever, cryptosporididosis. This is too early in the morning for these words, and toxoplasmosis and listeriosis. So just to kind of put this in perspective here, because I know that, you know, we hear all of these diseases being said out loud, and sometimes you're just like, yeah, okay, they can transmit those diseases, but we don't really have a good sense of scale on this. So we're going to turn to some chickens here to help us out with this. So there was a paper that came out that was looking at the number of mice on chicken farms. And so with this number, we kind of scaled up to the number of chickens that are estimated to live in the UK. So that's 155 million. And based on the ratios that they found in this study, we can scale that up and realize that there are at least 31 million mice on chicken farms. So keep those numbers in mind as we turn to another study, which live trapped and tested 63 rodents across 3 US farms. They went ahead and did DNA extraction on 63 rodent colons and then surveyed those rodents for harmful pathogens. So what this kind of looked like was that they took those rodent feces and then went ahead and did metagenomic DNA extraction. So this basically is asking what kind of bacteria or what kind of bacterial community that we're seeing in these rodents that we're sampling here. Then we went ahead and did that DNA extraction, did that library prep to kind of see where all of these DNA were kind of lining up. And then we're able to sequence that DNA and then create a overall perspective about this bacterial community that these rodents were carrying in these farms. And then, obviously from this, we can kind of speculate about the transmission and amplification about these pathogens into our food systems. So the species trapped included Mus musculus, so the good old house mouse, and Rattus norvegicus, so Norway rats or brown rats. We had multiple foodborne pathogens that were found, including Salmonella, Campylobacter, Staphylococcus aureus, and Clostridium, and all of these are bad news bears in a lot of ways in terms of public health pests. But the thing that we're going to kind of focus on here is that especially from this study, was that mice were very important carriers of Salmonella species and how it kind of escalated into poultry houses. So now it's time for everyone's favorite segment, mouse math. So one mouse can introduce 23 million Salmonella species bacteria into a production line in a single day. And according to the National Institutes of Health, infection occurs in a human occurs after ingestion of over 50,000 bacteria in contaminated food or water, with symptoms typically occurring 6 to 72 hours after consumption. So when you put that into perspective, one mouse produces enough Salmonella to infect 460 people per day. So if we go back to our 31 million mice on farms with one mouse with the potential to infect 460 people per day, that gives a potential of 14.2 billion people infected per day in the UK just from these mice on these chicken properties. So that really kind of puts a lot of things into perspective, right? It really kind of provides more of a sense of scale of how important it is that we manage these pests in these areas of our work. So not only with all of that kind of math in mind, rodents really do a number on our food supply. So not only in terms of physical damage and contamination, but it contributes to at least 20% of damage in the world's food supply. And just to kind of put this in perspective, a 6% loss could feed the entire population of Brazil for 1 year. And then when you put this in the monetary perspective, that's 21.9 billion pounds in terms of food losses. So again, really thinking about the public health implications of it, not even just the contamination side of it, but kind of looking at it from down the line, really. So thinking about that food loss and how that could impact somebody in their own family too, where they can't feed them because of this rodent issue. But also we're only kind of just beginning to understand, I feel like, the mental health impacts of rodents as well. Not all of them are going to be as famous or internet darlings as both pizza rat and more recently Reese's King Cup rat that were both spotted in the New York subway systems. But a recent study based out of Chicago from Murray et al. Examined associations between rat sightings and mental health. And what they found was that those who saw more rats had a higher incidence of depression. And honestly, even just talking with your clients, you can get the sense that this is really kind of upsetting to them. It can really be a huge problem in terms of the mental health. It can cause loss of sleep, which might, lead to problems in their jobs or in school if they're little kids. So there's a lot of really kind of other impacts other than the direct disease impacts that I think we're only just starting to understand a little bit more. And also too, you kind of have to also think about the economic impacts associated with rodents as well. Not only if a restaurant is closed because of seeing rodents and they're closed down by the health department or something like that, but it can also be due to damages caused by rodents. So maybe they didn't even see them in the restaurant itself, but that office building a couple of doors down maybe had a issue with an electrical system that was gnawed by rodents. And then that caused them to close for the day because the electrical grid was taken out just because the rodent issue wasn't taken care of. So obviously this can cause a lot of stress and strain associated with business closures. So this is another thing to kind of keep in mind too in terms of the mental health impacts, because it's not, again, just the rodents themselves. It's kind of all of the ripple effects afterward. So again, thinking about not just the rodents themselves in terms of the ripple effects they cause, but also let's talk about the things that kind of can come along with them in this regard. So let's talk about some of the ectoparasites that can also cause problems down the line as well. So we'll talk about fleas first, probably the most infamous of, of the ectoparasites that can accompany rodents. So this is going to be the order Siphonaphthora. These guys are external parasites of both mammals and birds, and they're responsible for the indirect transmission of several different diseases. And this is normally through quote unquote flea dirt. So this is actually the excrement of the fleas, where they are kind of depositing the pathogen in open wounds that they're feeding on or chewing on. And this is generally how these kind of diseases spread. So what kind of diseases do we happen to be talking about here with? So number one, Black Plague. I think everybody saw this coming. So this is Yersinia pestis. This is generally transmitted by the oriental rat flea. And as we well know, it is responsible for the deadliest pandemic in recorded history that we know in human history. Right now, there really are only a few thousand cases reported worldwide. It's not really as much of a problem anymore. We actually have more of a problem with it in the States than you guys do, because we do have a lot of prairie dog colonies that actually pop up with it every once in a while, which can make their way over to humans. But generally, this has been kind of put in the past, thankfully. But it's something to keep in mind that these guys are capable of really causing not only ripples in current history, but also kind of human history overall. And also, I don't know who put this picture of me in going to work in the morning, but whatever, it's fine. Okay, so let's talk about murine typhus as well. So this is actually kind of another one that's not as common, but it's still serious enough to give it a mention. So this is going to be from Rickettsia typhi. So this is both the oriental rat flea and the cat flea. So this will be rats, cats, and other mammals. In the States, we actually often see this transmitted through opossums. So North America's favorite marsupial. But there really aren't as many common outbreaks today. You guys in the UK really don't see this very often. Most of the time, it's somebody getting it from somewhere else and then coming back into the UK after that. But we do see it every once in a while. It's definitely more common in more third world countries. But we actually see it sometimes quite a bit in Texas. There's a lot of areas where that can potentially be an issue on that front. So again, just something to keep in mind, that it is an issue still and can occur, but these are kind of a little bit rarer breeds, as it may be. All right, so everyone's other favorite arthropod, ticks, or maybe not other favorite arthropod. So these guys are actually part of the class Arachnida. So this is actually going to be the same class as spiders and scorpions. Can be recognized by the 8 legs rather than the 6. The family is Ixodidae. These guys are quickly coming second most in medical importance and are very quickly becoming more relevant. So right behind mosquitoes, we are getting very concerned about ticks in the United States here, and in Canada as well. These guys are responsible for indirect transmission of a variety of different bacteria, viruses, and protozoa. But the main thing to keep in mind is that at least 27 pathogens have been transmitted by ticks worldwide across multiple hosts. So they're really becoming more of an issue in terms of not only are they interacting with us, but also they're interacting with a whole bunch of other animals that we are also coming into contact with. So it's really kind of creating the perfect stage for this public health pest. So when we talk about ticks, probably the number one on everybody's mind is Lyme disease. So this is caused by Borrelia burgdorferi, which is a bacteria. Borrelia burgdorferi is generally transmitted by the Ixodes genera, so those are going to be the black-legged ticks. In your neck of the woods, it tends to be Ixodes rhynchus, the sheep tick or castor bean tick. In our neck of the woods, the main bad bear is going to be Ixodes scapularis, or the black-legged tick, or the deer tick. But the moral of the story is that these ticks actually become infected by feeding on an infected host. So they aren't born with Borrelia burgdorferi, they actually acquire it over time. And so when they are feeding on them when they're younger, that's when they acquire that bacteria. And then when they're older, they look for larger hosts and then happen to latch onto us. And then that can be where we get it from. But there's a number, like I said, of other tick-borne diseases of concern. The main one in your neck of the woods is going to be the tick-borne encephalitis. You guys get a couple of cases of this every year or so. So that is kind of the main one to look out for in terms of tick-borne diseases on that front. However, in the States, we are so lucky. We have so many more. So we have anaplasmosis, we have babsiosis, we also have Rocky Mountain spotted fever, Powassan virus, Q fever, tularemia, and this is not the full list of ones that we can get in the United States. And again, this is not just going to be that Ixodes genera. It can be generally mostly the problem, but we're also seeing it from the Dermacentor genus and also the Amblyomma genus as well. And also, speaking of the Amblyomma genus, we recently have seen other tick-borne things of concern. I guess I would call it a disease, but it's not. It's more like a chronic allergy change. So I'm sure many of you have started to hear about this thing called alpha-gal syndrome. And more commonly, it's referred to as the red meat allergy. So we have seen cases of people getting bitten by Lone Star ticks and then actually developing an allergy to this sugar called alpha-gal. And unfortunately, this sugar is actually in the surface of a lot of red meats. And so because the alpha-gal, which is in the saliva of the tick, the body and the immune system says, oh no, that's a thing that I need to pay attention to. And then they're no longer able to eat red meat. Which is a real bummer because that includes bacon. So this is really becoming a thing that we're very concerned about, not only as entomologists, but also as public health professionals as well. And especially too, we have seen a couple of cases of this alpha-gal syndrome pop up in people who have gotten bit by the Ixodes ticks. So it suggests that we have started to see a little bit more transference of that. For whatever reason, they aren't quite sure why that's the case just quite yet, but this is something to just keep in mind on that front, because there's a lot of things on the horizon, and it also really emphasizes that the game is constantly changing, right? So you constantly need to be thinking about ways that this could potentially happen. And so not to scream constant vigilance, but that's kind of what I think this story really kind of emphasizes. And then the other thing too that I wanted to emphasize is that keep in mind it's not just people. So I ride horses in my spare time, and I went to go grab my mare out of the field, and I noticed she had this on her. And I pulled it out, and it was a fully engorged tick, like so fat that you couldn't even see the legs underneath of it. So we're also starting to see that these diseases, not only from fleas and ticks, but also rodents can really impact not only people, but also the pets around them as well, which again kind of creates this whole melting pot of these potential diseases that we need to think about when we're doing these pest management professional works. All right, so let's kind of wrap things up here on this front. So, what about the rodents of unusual size? I don't think they exist. In terms of physical size, I would say yes, they don't exist. But in terms of the public health implications that they have, I would argue that they are really, really important and are of unusual size. And, much like Wesley here, they can kind of catch us off guard a lot of the time. And this is why our job is so important, because we're the ones responsible for kind of mitigating that unusual size, right? So just to really wrap things up here, so rodents can really affect public health in more ways than one. So I hope this kind of brief foray into all of the ways that rodents can really influence our life in that regard can really is really evident here through this talk. And really, what I wanted to mention too is that this is why your work as a pest management professional is so important. We talked about the rodents themselves and, the things that they can cause there, but it's the after effects. It's those aftershocks from that initial earthquake that are so important. And so, what I really wanted to emphasize is that it's really valuable to take a step back every once in a while to kind of remind yourself of the why. Why do we do what we do in pest management? Why is it so important that I manage these rodents? And the reality is, we're protecting public health. We are at the forefront of that. And so I think it's always good to kind of step back a little bit and just really remind yourselves of that every once in a while. And it's hard to do it. I get it when you're like in the job, in the, I just got to make it to that next stop. But, really think about the why. Think about the why of what you're doing and why it's so important. All right, so that is all I had. I'm sorry that's a little short, but maybe maybe we got us back on track there. But I really appreciate the time being here today, and I would happily take any questions if anybody has any.
Perfect. Thank you, Laura. That was fascinating. I'm so glad I'd already eaten and taken the dog for a walk this morning because it's not something I want to do either. Um, yeah, ticks. We have with this year we've had quite a few ticks. I'm sort of northeast England, and we went to a falconry show one day, and my son got one on his neck.
Oh no, yeah.
Yeah, so luckily we've got our vets was like on the way home, so I nipped in and was like, just borrow a tick tom to take this out my son's neck, please. Luckily it just went red, and then a few days later it sort of disappeared, so we just kept
Yeah,
an eye on it. But
yeah,
yeah, I've had them before on my clothing. I've never had them, but the dogs, we live in quite a rural area. The dogs have them quite a lot, so always fun one to do.
yeah.
There's a question around sort of deep cleaning and sort of recommendations. Obviously, if we recommend that people wash contact surfaces if they've got a rodent problem, is there anything that you'd particularly advise that they use? Bleach, maybe, or is there something that it works well for managing that disease
Yeah,
threat?
I mean, kind of any disinfectant will do the job. It's just it's more a question of what surface it is, because obviously if it's cloth, you don't want to pour bleach on top of that, right? You're gonna get a really angry client really fast on that one. But so yeah, I mean, it just kind of depends on what the surface is on that front. But kind of use your best judgment. There's a lot of disinfectants out there, so I won't shout out
Yeah.
one in particular, but yeah, I mean, it's kind of the more anything is really is kind of useful as long as it's a disinfectant.
Yeah, I mean nowadays there's lots, and I suppose with like COVID, it's highlighted. We went through a sort of a learning process of what really works and what doesn't work. And I remember there was a product that we had, and I forget what it was. And then it was like on the news, don't use this because it doesn't really do anything. I was like,
Yeah, yeah, yeah. I mean,
"Mm,
just kind of keep up with the literature, but for the most part, I feel like you said, I feel like COVID was a real learning curve for a lot of us in a lot
yeah,
of ways.
I was at a thing yesterday, an event, and they were talking about hand washing. And the first thing he said there was, "Well, since COVID, we've all got really good at hand washing."
Yeah.
So great. Do you use, is it ozone in the US? Assuming it's a product.
Um, you know what? I don't know off the top of my head, to be quite honest with you. Yeah, I don't
Yeah.
know that I can speak to that one very much. I'm sorry.
Uh, that's okay. There was a point, someone just said that disease vectors are not focused on enough. Thank you for a really informative presentation. That was a good one. In Scotland, Roberts found hares covered in ticks.
Oh, okay.
Yeah, I mean, I'm assuming that would just be something that's like come into contact with it. We've had sheep, the dogs, obviously. I've seen deer with ticks a few times, so they do get around. I had a rat once, I think, that had ticks on it. or something
Yeah.
along that lines. So you do get them. It's like fleas, isn't it? Really, if there's something nearby and it transmits to it, although they don't maybe breed so well on other mammalian blood, but they will, survive on a host, as it were, for a period of time.
Yeah. Yeah, for sure. Yeah, we have a problem here in the States right now with white-tailed deer, and the tick populations are really just surging because they're able to grab onto them, and they're, we kind of call them the big rats in a lot of ways here, just because there's kind of nothing that we can really do about them, but they're everywhere, and so the ticks just kind of have a free buffet on the deer, which is really kind of contributing to our tick problem right now, along with the warming temperatures and everything like that. So
Yeah, ours seem to be quite. Some years we'll have, some years the dogs have been covered in them every time we've been out for a walk, and then like this year, don't think we've seen any. I suppose like parasitic insects. We haven't had many like mosquitoes and things like that, and we've not had any ticks. Apart from my son had one earlier in the year, but we've not had any, a lot of them where we are. So we do go through phases as well, where some years it's really bad, and some years, we hardly see any, which is, I suppose, nice in some ways. I don't know if you'll be able to answer this one because Prevention of Damage by Pest Act, I think, is mainly UK based. But can infections be justified as a notice served under the Prevention by Damage by Pest Act?
yeah, I don't know that I can.
No, I am not sure. I can't remember
Apologies
what's.
for my American
Yeah,
sensibilities, but
I'm not sure what's in the Prevention of Damage by Pest Act when they look at it as to the justification for controlling pests on property.
Hmm,
But I can have a look into that. That's quite a good one.
yeah,
Perfect. Thank you for that, Laura. Thank you for getting up really early for us.
yeah, no
Again,
worries. I always appreciate it. Thank you guys.
great
Really, really fun to
presentation.
be here. Thanks. Bye.
Thank you.